You know that post-lunch slump where your belly feels full but your energy is low? I was at my desk last week, big bowl of pasta, and 2 hours later I felt heavy and foggy. I remembered a tiny sip, literally a teaspoon, of a bitter tonic my grandmother used to give me. 10 minutes later I felt lighter, actually more awake. That little shock to the palate changed everything. Today, we're talking bitters, why they work, and 2 kitchen demos you can do with things from your regular grocery list.
Welcome back to Earthy Remedy. I'm Fiona, and with me as always is Samnang. Today, we'll translate the science of bitter receptors into simple kitchen moves, and we've invited 2 guests. Dr. Miguel Alvarez, a gastroenterologist, will walk us through the safety checklist, and Leela Chang, a traditionally trained herbalist, will share culinary bitter wisdom. We'll also guide you step by step through a 5-minute bitter tonic and a bitter greens meal. All recipes and a 2-week microtrial are in the show notes.
Hi, Miguel. Hi, Leela. So glad you're here. Quick note for listeners. Everything on air is strictly culinary, low dose, and we'll name who should pause before trying bitters. Safety first.
Thanks for having me. I appreciate the safety first framing. I'll be here to highlight when bitters are a good fit and when we need a clinician involved, especially for people with active ulcers, reflux flares, or certain medication interactions.
So happy to join. I love bringing plant wisdom back to the kitchen. Bitters are simple, humble plants and leaves, but they do a big job when used gently.
Let's start with the basics. Why do bitters actually influence digestion and appetite? In plain terms, your tongue and gut have bitter receptors. When those receptors are activated by a small, concentrated bitter cue, they trigger a cascade, saliva, gastric juices, bile in some cases, that helps prepare the digestive tract to handle the meal. That can mean less bloating, better appetite regulation so you feel satisfied sooner, and in some people, a steadier post-meal glucose response because the body is primed to manage incoming food.
So it's like waking the digestive system up before it meets the food. A respectful handshake, not a shove. In my experience, a tiny bitter cue before and sometimes between bites changes how much you want to keep eating.
That framing is helpful. Clinically, we see bitters can support digestive secretions and motility at culinary doses. But I want to be clear about red flags. If someone has an active peptic ulcer, an acute reflux flare with severe heartburn, signs of gastrointestinal bleeding, unexplained weight loss, or diagnosed gastroparesis, bitters can worsen symptoms. Also, concentrated herbal extracts can interact with medications. For example, some bitters can affect blood pressure control or platelet function. So check with your prescriber or pharmacist if you're on blood pressure meds, anticoagulants, or other chronic prescriptions.
To add, for people tracking glucose, small food-level bitter cues may help with appetite and steadiness, but don't treat them like a glucose-lowering medication. We provide a clinician-reviewed interaction checklist in the show notes so listeners can bring it to their provider.
Okay, quick bridge before we cook. If you want to follow along for either demo, have measuring spoons, a small pot or kettle, a mug, a cutting board and knife for greens and peelings, and a jar for vinaigrette. We'll keep everything single serve so you can taste and then decide if you want more.
Before we demo, a quick note on culinary versus therapeutic dosing. Traditional uses often involve infusions, small sips, or adding bitter leaves to meals. That's different from taking concentrated tinctures or high-dose extracts. Today's recipes use kitchen-level amounts. Think a teaspoon or a small forkful, meant to be a gentle cue, not a treatment.
And nutritionally speaking, pairing bitters with a little fat or acid can improve the sensory balance and help with absorption of certain compounds. For example, a vinaigrette with olive oil and lemon can both soften the perception of bitterness and support fat-soluble nutrient uptake when appropriate.
All right, Demo A, our 5-minute bitter tonic. I'll read each ingredient slowly so you can jot them down. 1 cup of filtered water. 2, 1 teaspoon of grated dandelion root or a culinary gentian substitute. We note substitutions if you don't have gentian. 3, a strip of lemon peel about ½ inch wide. 4, a teaspoon of raw honey or maple syrup to taste. 5, optional pinch of cinnamon for warmth. Equipment: small pot, a spoon, a fine strainer or small sieve, and a mug. Step 1. Pour 1 cup of water into your small pot and turn heat to medium-high. Step 2. While the water warms, grate your dandelion root finely. You'll notice an earthy aroma. If you're using a gentian tincture at culinary dilution, add a dropper's worth to the mug later. Our show notes explain exact dilutions. Step 3. Once the water reaches a gentle boil, add the grated dandelion and the lemon peel. Lower heat to a gentle simmer and let it steep for about 3 minutes. You'll see the water take on a warm, slightly amber color. Step 4. Remove from heat, strain into your mug, and if you like, add that teaspoon of honey and a small pinch of cinnamon. Step 5. Take a single small sip before your meal. Notice the sharpness on the tongue. Then wait a minute and notice any change in salivation or alertness.
A practical tip. Start with 1 teaspoon or 1 small sip. Wait 24 to 48 hours before increasing. If you feel nausea or symptoms worsen, stop and consult the red flag checklist. For people on meds, especially blood pressure or blood thinning meds, check the show notes interaction checklist before trying even culinary bitters regularly.
Now, Demo B, bitter greens meal with a taming dressing. Ingredient list. I'll read slowly. 1 small head of radicchio, or 2 handfuls of arugula and chicory mix. 1 cup of roasted root vegetables like carrot or beet for sweetness. 2 tablespoons toasted seeds or nuts for crunch. For the dressing, 2 tablespoons extra virgin olive oil, 1 tablespoon lemon juice or apple cider vinegar, ½ teaspoon maple syrup or honey, a 1/4 teaspoon Dijon mustard, and a small pinch of sea salt. Equipment: mixing bowl, jar with lid for the dressing, baking sheet if you're roasting, and a spoon. Step 1. If you haven't roasted roots already, roast thin slices at 400 degrees Fahrenheit. We'll say 20-25 minutes in show notes. For a single-serve shortcut, use leftover roasted veg or quickly sauté in a pan. Step 2. Toast your seeds in a dry pan until fragrant, 30 seconds to a minute. You'll smell them pop.
Step 3. Make the dressing in the jar. 2 tablespoons oil, 1 tablespoon acid, ½ teaspoon maple syrup, a 1/4 teaspoon mustard, pinch of salt. Close the jar and shake until emulsified. The fat and acid will soften the bitterness and increase the palatability, and the little bit of sweetener rounds the edge without overwhelming the greens.
Step 4. Toss your greens with the warm roasted veg so they wilt slightly. Add the toasted seeds and dress lightly. Taste a small forkful and notice, does the dressing tame the bite? If it's still intense, add a touch more oil or cooked veg. For sensitive stomachs, swap radicchio for baby spinach or blanched chard to start, or simply add a small bitter leaf as a garnish rather than the base.
From a traditional perspective, bitters are often paired with cooked or fatty foods to make them more acceptable while still getting their signaling effect. In many cultures, a small bitter relish or a few leaves start the meal. The goal is balance. A little goes a long way, and tradition always suggests you watch the body's reaction and respect it.
Let's talk about the 2-week microtrial so listeners can test results. Step 1. Pick 1 demo, the tonic or a forkful of bitter greens, and do it 10 to 20 minutes before a main meal, once a day for the first 3 days. Step 2. Record simple metrics each day, a 1 to 5 bloating scale, when hunger returns after the meal, mid-afternoon energy on a 3-point scale, and any nausea. Step 3. After 3 days, if tolerated, try twice a day or add a second meal cue for up to 2 weeks. If you're tracking post-meal glucose, take note of your readings per your normal routine and share with your clinician.
And embed stop rules. If you notice worsening heartburn, new abdominal pain, black or bloody stools, or unexplained weight loss, stop immediately and seek medical evaluation. Pregnant or breastfeeding people should consult their clinician before starting any regular bitter ritual, and anyone on chronic medication should check interactions that we've summarized in the show notes.
We'll also note affordable sourcing. Dandelion root tea, radicchio, chicory, and arugula are easy to find. If fresh roots aren't available, high-quality dried dandelion or culinary gentian at low dilution can be used, but our show notes show exact culinary dilutions so listeners don't accidentally take medicinal doses.
If you're sensitive to straight bitters, try fennel or a little grated ginger as a digestive-friendly alternative. Both support digestion without the sharpness some people find off-putting.
Quick recap. What matters is small, consistent cues and careful attention. Bitters at food level can prime digestion, help with appetite regulation, and may support steadier energy. But they're not for everyone, and they're not a replacement for medical care.
Before we go, a quick reflection. This is about building tiny rituals that support how you eat. One small step that signals your body to do what it's built to do. Try one demo this week. Notice the difference. You've got this.
We'd love to hear how it goes. Tag @EarthyRemedy on Instagram or send a 60-second voice note with your result. Did you try the tonic or the salad? We'll share a few listener notes in a future episode. And don't forget to download the 2-week microtrial and the recipe cards in the show notes.
Thanks so much to Dr. Miguel Alvarez and Leela Chang for joining us. Your perspectives made this practical and safe. And thank you, listeners, for trying small, nourishing changes that can add up.
Thank you. And remember, if you're ever unsure, bring the checklist to your clinician. Start low, watch for red flags, and keep communication open with your healthcare team. And remember the pleasure of it. A little bitter can make the whole meal sing. Enjoy the ritual.